So I'm Leanne. I'm the lead policy governors at St John of God Healthcare.
Thank you, Leanne. It's great to have you here. Tell me a little bit more about why you're here at the RLDatix Asia Pacific Summit.
All right, so I've been working with RLDatix since 2021. We brought them on board for our policy stack, policy library consolidation project as a software solution. And they invited me to come and speak at the conference.
Yeah.
So here I am. And I was really looking forward to meeting the other industry professionals.
Yeah, it's good to see a good mix of, those that are from the healthcare system and the aged care side and other bits, as well as people from RLDatix and here and across the world, really. But so St John of God, for those that aren't familiar, tell me a bit more about the breadth of services provided.
Yeah, so 17 hospitals and services. It's international, so we also have organisations over in New Zealand, Timor-Leste. So, so we do, it's multi-jurisdictional.
Yes.
And so it's across Australia, so in New South Wales, in Victoria and in WA. Yeah, so it's really, really broad. We offer lots of different services. So not all our facilities are acute care patient facilities, but we have mental health facilities. We have disability services as well. We have disability housing, social outreach programs. It's really, really diverse. And so what I do in policy, I cover all of that from a governance model.
Yeah. And I would imagine that given the breadth of diversity and services provided and in geographical locations, trying to encapsulate all of that would be a challenge from the policy and governance side. I mean, that's a wide breadth of stuff to cover and something that's ideally quite standardized and easy to follow.
Yeah, it is. It is and it isn't. I mean, because really one St John of God Healthcare should be a one story for everyone. And so that's what we try to do in policy, is create one policy to suit as many of our caregivers as we possibly can. And so you can't do that for everything, of course, because if it's a maternity policy, it's only going to apply to your maternity hospitals. If it's a mental health policy, it's going to apply to your mental health facilities. However, if it's like a workforce policy, yes, then you'll apply to all your caregivers. Doesn't matter where they are, because it's the St John God Healthcare way.
Yes.
And the legislation that drives that, though, is the jurisdictional legislation that will restrict sometimes of where you apply your policies. And so the same things that we use, like say in WA, in some of our controls that policy puts in place, is not applicable for us to use in Victoria because the legislation won't allow that. They have different legislation. So we have to then say, okay, what's the exception?
Yeah, I see.
How do we use that? And how are we mindful of it? Yes. And then we obviously drive our policy towards the best solution. And instead of doing two policies, we sort of raise the policy up a bit to a level of best practice, and we go with the one that has the highest standard.
Yeah, okay. We have quite, our audience is broad across talking health sector, but there might be someone that's listening to this and, looking at, what a career looks like in healthcare around policy. Because I guess if you're familiar with the concept of a policy anywhere else within, a business environment, sometimes it can be like, oh, we kind of need that. Yeah, I guess that's documented there and it might kind of live in a drawer. But tell me more about because, we see so many policy professionals, I guess, or who are passionate around, ensuring that there's high quality and the work that RLDatix is doing around it to support it. So I guess if you're unfamiliar with the space, you can't be like, well, why is there so much attention on it? So when we say policy, why is it so I can hazard a guess as to why it's so important, but what does that kind of look like too?
Yeah, so we use policy as the expression to control behaviour. So that's the fundamental. Why do we want to control behaviour? Why do we want to put guardrails down? And that's what we want. We want the guardrails to keep our caregivers and our patients safe. And so that's what policy and healthcare does. So you're actually implementing guardrails. You will work within these guardrails, and this is how we will inform your behaviour at St John of God Healthcare while you're working in this space. And it's really important because implementation of policy and the policy being alive and active is also really important. You don't put it in a drawer at St. John of God Health Fair. It doesn't work like that because these are the policies you're going to be using in everyday practice. Right. And so you'll be actually referring to them, your medication administration policy, the guidelines that we put in place, the guardrails, because we want you to deliver medication in a certain way so you don't kill anybody. It's really important that we have that and that they're alive and active. So how we implement those and how we allow and inform our caregivers to access them and to be informed by them is a really important key to making those policies remain compliant. So our caregivers are compliant with those.
Yeah, I was going to thinking too, to be able to provide that support and to give the caregivers, clinicians, staff the ability to be the best versions of themselves and utilize their professional skills and the qualifications. And it's healthcare, it's humans, it's messy. And while it's, there's so much information that's consumed, they need to then deploy that care in certain ways. And I guess to be able to have the support and the best structure around it, though, that makes a lot of sense. So I saw you up on stage earlier, sharing some of your insights and reflections with attendees. Tell me a little bit more about what you covered today.
Yeah, so today we've really covered what we call the ICE plan. And the ICE plan is the implementation, communication and evaluation plan. And it's boiled down to 5 questions that we ask all of the people who are either reviewing policy or developing policy. It's like we say, okay, what's the purpose? What are the particulars? What are the people? What are the payoffs? And what's the evaluation? And those 5 questions become quite detailed and in depth. And so once they can answer the questions, then they're able to actually understand what they need in their policy. And that'll help just bring everything to the surface. It'll tell them, who's going to be affected, where they're going to be affected, how they're going to be affected, right? And it will just bring everything to the surface. And so the ICE plan, we call it the interrogation of like the why. Why do you need this? Because so many people, it's a SAC 1, got an incident, I need a policy.
Right, yes.
But you don't, right? So maybe the policy is already there. You just didn't read it, or you weren't at the time able to think about what that content was going to look like for you when you were trying to find it in the library. And so you sort of say, well, you don't really need a policy on this because we have this and this and this that manage that control. And if you had, looked at this, you would have seen that we're already controlling this behavior here, controlling this here and this here. This incident is human error.
Yes.
And you can't avoid human error, like I said. Like it's always going to be a user end focus. But policy, we've come to understand, is about 10%. 10% of perhaps change due to an incident than me. Right? It's mostly education for the caregiver. It could be the system's not working.
Yeah.
But it doesn't mean the policy's not working. The policy's probably quite robust.
Yeah. Well, I guess, and you don't want to add more policies for the sake of adding more policies. You just create complexity. If anything, you want less policies.
Well, so you don't want duplication.
Yeah.
Right? One single source of truth is what we designed for our caregivers. We said, well, when we asked them, they said, well, this is what we want. We want anywhere, anytime, any device, a single source of truth. So that's, the type of access that they wanted to their policies because they are using these policies at the bedside, in the operating rooms, in the med rooms, so on the road when they're going out to treat patients at healthcare admin. Yeah. They're using them in their own patients' homes, and they're using them while they're actually at the services as well. So there's very different applications, and they need the policy in front of them at any time. They can go on their phone straight away. Here it is. I know that if I search this, there's only one result. Yeah. And that's really important because then they've got faith in the content. Oh, yes, I know this must be the one because there's no other way.
That's really cool. Hey, lastly, Leanne, I guess one could be forgiven for thinking that if there was an area of healthcare that, in this age of fast-moving innovation and change, if there was an area of healthcare that is probably just going to remain consistent, it would be policy. But like as you've kind of outlined, there's continual evolvement, and as we've seen in some of the sessions too, there's technology around it that's continually evolving too. What's exciting you about like what's coming in your space, you know, in this industry that you're really looking to get amongst?
What I really like to see here is AI in the search engine, because our caregivers, but instead of searching keywords, I want them to search for the reason. Show me how, or show me where I can find this. Show me what I'm looking for if I need to find out about coronary care.
Yeah.
A broader, intuitive type of search engine that will give them multiple results from the library on that specific topic, which is so good. And that's what's coming in Policy Stats.
Yeah.
Very excited about that. And I'd also like to see much more integration into policy living with compliance registers, like, you know, how they live together, how they can come together, because the policy is a control for the compliance that we need to obviously manage. And then you've got your compliance register sitting over here, and very rarely the two are sort of integrated. I'd really like to see an integration of that, and that would be really helpful. And also your risk registers as well, like, you know, how does policy become more involved, getting more into that risk assurance space, and how do we look at bringing those together as a story as well, because there are so many overlaps along the way. So true. That's what I'd like to see.
Yeah, nice. I like that.